Good evening. The government has caved to mounting pressure over our hospital crisis.
Cash that was earmarked for the convention centre facelift will be diverted. It means the ageing venue, dubbed the Cockroach and Shed on the Swan, is here to stay.
As Jeff Parry explains, the funding backflip adds desperately needed beds to our struggling public health system.
Governments try to hide lots of things, but they couldn't hide this. Record ambulance ramping caused by a pitiful lack of hospital beds when they're needed most. The solution was money, and now they've found a ton of it, $1.5 billion.
We are buying a hospital, building a hospital and upgrading a hospital.
The Mount Lawley Hospital, with views of the Swan River, is currently operated by St John of God Healthcare. With 197 beds and 8 operating theatres, the deal should be completed next year for an as yet undisclosed sum.
This is about adding capacity to our public health system.
On the sprawling Royal Perth Hospital site, plans are underway for a brand new 6-storey building currently occupied by research laboratories. The emergency department will relocate to the first 2 floors, with the remaining 4 floors part of a hospital expansion. $33 million have been allocated for planning, with building starting in 2026. And plans to renovate Peel Health Campus near Mandurah thrown out and replaced by a brand new hospital on vacant land next door. It'll be 6 storeys with a 39-bay capacity in ED. Work on the new hospital will start next year.
I think going with a greenfields new hospital build is a much better approach than continuing to patch up the system that we have, and that's the kind of investment that we've been calling for.
Projects announced today come on top of the Women's and Babies Hospital at Murdoch and hospital expansions in Geraldton and Bunbury.
We have a laser focus on delivering these critical hospital projects.
This shift in focus serves to blunt what has been a relentless attack on government health policy by opposition leader Basil Zempilas and before him Libby Mettam.
Finally, the state government have recognised their failings, the lack of planning and the increasing capacity that is required for our ailing Western Australian health system.
The winners are the sick and the people who care for them.
These are the kind of investments, announcements and changes that we needed to see in order to feel some level of comfort that things are going to get better.